Okay, so we are looking at quite another concept. Um, this is another concept here. Neonatal resuscitation. All right. So for neonatal resuscitation, you just have to do it. Maybe the baby is weak, respiratory issues, so you have to bring them back to life. Okay. So for neonatal resuscitation, you should just know that it's an emergency care. So it's usually given to a newborn who is not breathing, or the newborn has become weak. So you're trying to bring them back to life and all of that. So it's a critical skill in obstetrics and pediatrics, as about 10% of newborns they need help to start breathing. So less than 1% require full resuscitation. All right. So for the key steps in neonatal resuscitation, based on the current guidelines, initial assessment is you are actually trying to check if this baby has actually reached a stage where they're supposed to actually be giving birth to in the first place. So the baby has a good tone, all right, if they are breathing or crying, all right. If yes, provide routine care like warmth, clear airways, dry, ongoing evaluation. If not, begin resuscitation. Initial actions within the first minute. So warm the baby, maintain normal temperature. Position the head to open the airways. Okay. So clear secretions if needed. So you stimulate the baby to breathe, rubbing the back, the soles of the feet. Alright, so ventilation support to enter. So the baby is not breathing or their heart rate is less than 100 beats per minute. You begin positive pressure ventilation with a bag or mask, something like this. I think I actually have the picture, something like this. Alright, so effective ventilation is the most important step in neonatal resuscitation. Okay, chest compressions. If the heart rate is so low, below 60 beats per minute, after 30 seconds, you begin chest compressions. Medications, if there's no improvement, you can administer things like epinephrine. Consider volume expanders via the umbilical venous access. All right. So I think that was it for the whole concept of neonatal resuscitation. Okay.